Thank you for joining AARP's Advocacy Forum series today. Today we will be focusing on services and programs that benefit older adults as they age and need care, either in their home and communities or in long-term care facilities. These issues are addressed in the state budget, so we are really lucky to have a panel of experts that represent different perspectives in this issue. I am Lisa Regal. I am the manager of advocacy for AARP's North Carolina office. And with me, I have three great speakers. First, we have Senator Burgin, who represents District 12, which is Harnett, Johnston, and Lee counties. He's become or has been a leader in the legislature on health issues. He chairs the House Health and Senate Health and Senate Health Appropriation Committees, as well as serving on several other committees such as Transportation, Pensions and Retirement and Aging, Commerce and Insurance, and Ag and Environment. In his professional life, he's perfect to understand these issues because he's president and owner of C&D Insurance and Insurance Network Group, which provides property, health, and life insurance. He hails originally from our neighboring state, Tennessee, and went to University of Tennessee in Knoxville, where he has a BS degree in business administration. So thank you, Senator, for being here. Heather Burkhardt used to work at the DHHS, is now executive director of the North Carolina Coalition on Aging. We work with them very closely. She has over 25 years of experience working on behalf of older adults and caregivers, spanning both the nonprofit and state government sectors. She served for 18 years at the North Carolina Division of Aging and Adult Services, and she has her degree in gerontology from Eastern Carolina University. And last but not least, Juan Jefferson. He represents the provider, the group that provides these services. He is the director of the Vance County Office on Aging and the Senior Center in Henderson, North Carolina. And he's been doing that for at least the past 10 years, and he's responsible for overseeing all aspects of senior center operations with 11 full-time employees, 3 part-time, and more than 80 volunteers that serve the older adults and various services and programs funded by home and community-based block grant funds, which we're going to see a short video on that later and hear more about. And he has his bachelor's from St. Augustine and a master's in public administration from Strayer University. So you can see we have a diverse panel, and we're very excited to have them with us. As you listen in, you can type some questions in the chat. If we do not get to them, don't worry, we will answer them, and they will be available for viewing either immediately or later on Facebook, because this will be captured as a YouTube video available on Facebook, and you can see the answers to those questions. So I am going to start with our Senate, Senator Burgin. With COVID, we've shown a light on the weaknesses in our healthcare system and some of the services that we provide older adults. But luckily, the federal government has some COVID relief funds and the American Rescue Funds. And how will those benefit these programs on our aging population?
Well, Lisa, first, thank you. And thank you to AARP. It's a pleasure to be here today, and it's an honor to serve in the Senate. The money's been going to a lot of different things. We've been looking at getting money for food relief. A lot of people have experienced issues with food. Money for housing, trying to make sure that people, if they do rent, that they're protected and they have the ability to stay where they're at. Things like telehealth, the money to pay for telehealth for everyone has been out there. We were kind of relooked at a lot of things and services provided to folks to make sure that we don't let people drop through the crack. I tell folks all the time that I feel like it's my duty to protect children, the elderly, and the disabled. I want everybody else to have the opportunity to work, but those classes we need to look after. We need to take care of them, and we're working on a lot of bills that do that. And I'll talk about some of them in a little bit if we get into that. But some things like surprise billing, transparency of billings. Worked on a pharmacist bill yesterday that we'll be presenting Monday. There's just a lot going on in healthcare and a lot of things that I think are going to make healthcare more available to folks, especially our senior citizens.
Great. And just as a follow-up, what we found is a lot of these long-term care facilities and even people living in their homes had a hard time getting the direct care workers to come and care for them in their homes and in these facilities because they're just paid, I think it's an average of $9 or $10 an hour. Do you think there will be any additional funding in the budget for these important caregivers that support our older adults?
Yes, ma'am, you are. You're going to see additional money for childcare and for care workers for the adult community. The things that the federal government did and the state participated in it actually encourage people not to work. When right now, between the money you get from the federal government and the state, you can make about $18.75 an hour not working. So you can imagine people that were making, I think I was talking to the daycare folks the other day, and I think the average was like $12.50. Now we've adjusted a lot of these pays up during this time, but a lot of that's going to run out in September. Or September and up to December, depending on which program it's in. So we're going back and putting money in the budget to raise those things. And then we're taking a good hard look at it about what we need to do. We need people working. Those jobs are they're critical, really, because we've got people that unless those people are there, they're not going to get the services and the care that they need. So we see this as a big issue that we're going to deal with.
Thank you for that. Yeah, we've noticed, we've just been studying the whole caregiving issue, and it's just a growing problem that I think we all need to work together to look at it as a long-term solution. Recruiting, retention, et cetera. It's hard to compete with the big box industries that can pay better wages and give benefits. But we really appreciate understanding that we need to boost it up, at least in the short term, with additional increase in wages. So thank you. I'm going to turn and let a couple of our other speakers talk about a few things before we show the video. Heather, we just heard that we're not seeing the birth rates that we used to. There's actually the population growth is really in the older sector, where 1 in 5 adults are going to be over the age of 65. And with that growing aging population, do you think we're ready for that population shift with our programs and services?
Yeah, thank you, Lisa. I appreciate AARP and the opportunity to be here today. And you're absolutely right. North Carolina is an aging state. In 2019, we had more older adults than children for the very first time in our state. And so that has huge implications on policies and programs. And, we're experiencing that shift a lot more. It's a national shift, but North Carolina is on the front end of it. And it has a variety of reasons. I mean, number one, we know the boomers are aging, and that a lot of North Carolinians are aging in place and they're living longer, which is exciting. And North Carolina is also fortunate because we have such a strong economy that we attract a lot of in-migration, people from other states who come here to be with their children. Maybe they came and vacationed here as they were working and they like North Carolina, the things that we have to offer. And so we're definitely a state that attracts older adults in addition to the North Carolinians that were already living here. And having this aging population brings so many great opportunities, in terms of our economy and the contributions that older adults bring to communities with service and volunteerism. And I think it's really exciting, and it's a great place for North Carolina to be in terms of attracting older adults. We want to make sure older adults are staying healthy, they're staying engaged, and we want to make sure North Carolina remains an aging-friendly state. And so being able to focus on what Senator Burgin said, healthcare, and have quality to access healthcare for older adults is important, as well as a robust continuum of care of services they need. And so we do need to plan. We need a roadmap that looks at North Carolina and all the facets that older adults touch those lives, whether it's health and well-being, as well as long-term services and support. So we want North Carolina to remain an attractive state and provide a variety of services for people to age well in North Carolina, and definitely doing some planning and making sure that we have our things in place to support older adults is really important.
Thank you, Heather. I'm going to ask one other question everybody has to mute, sorry. So unfortunately, on a sadder topic, we see more we need the need for adult protective services, and to prevent and to investigate elder abuse and financial exploitation. These are not happy topics, but unfortunately with COVID and that growing isolation, we see these numbers increasing. Can you talk a little bit about the need for supporting adult protective services?
Yeah, absolutely. Adult Protective Services, for people who don't know, it's a state mandated program that puts in place a protection system for people who are 18 and older. So all adults, not just older adults, but anybody who may be at risk of abuse, neglect, exploitation, financial exploitation, even self-neglect. And so that service is provided as a safety net to all adults. And so just no matter where you live in North Carolina, you have that service available to you. And no matter what your income is, so you can, it's available to protect people despite income, and you can live in your own house or with family members, as well as adult care homes or assisted living nursing homes. So regardless of setting, and that program's provided by all 100 county departments of social services. It's supervised at the state level, but administered at the county level. And it's those social services programs at the county level that are mandated to investigate and substantiate those adult protective services programs. And just last year, we had over 30,000 reports of abuse, neglect, and exploitation in that throughout the entire state. And we know that 81% of the funds to support adult daycare, or sorry about that, APS, Adult Protective Services, are funded by the county. And so it's counties that are bearing the burden of that. The other dollars are federal social services block grant dollars that are invested. And so it's those two funding sources that fund those county departments of social services. And we don't have a state investment at this point. And to ensure that we have a real quality program and that counties are doing and implementing it consistently, and that we have adequate staffing and training, we really do need to make sure we have adequate funding to make sure that North Carolinians are protected from abuse, neglect, and exploitation.
Great, thanks for explaining these programs that many of us probably don't even know exist. We have lots of questions that we can ask Senator and Heather, but let me go to Juan because we want to hear from a provider's perspective. But first, we're going to look at a quick video that explains some of these services that we are able to provide to the community because of funding. And
North Carolina is aging. By 2028, 1 in 5 North Carolinians will be 65 and older. As state lawmakers work on the budget, AARP and other advocates for older adults are urging the General Assembly to invest in important programs that help older adults live independently in their own homes and communities. Home and community care block grant funding is critical for adults who want to age in place. These grants support programs like Congregate and home-delivered meals, adult daycare, in-home health aides, caregiver support and respite, and much more. These services are essential to the well-being of seniors as well as their family caregivers. Alan Winstead, Executive Director of Meals on Wheels of Wake County, explains.
More and more people want to age in place, want to live at home as long as possible. And community-based organizations deliver those services. Meals on Wheels is one of those services that's funded by the Home and Community Care Block Grant. Every county in North Carolina has a Meals on Wheels program that delivers hot, nutritious lunches. And then in addition to delivering those lunches, folks get a safety check, a time for socialization, and then a connection to local community resources.
AARP is urging the state Senate to support home and community care block grant funding to help North Carolina prepare for the needs of the fastest growing segment of the population. To learn more about other support needed, visit www.aarp.org/NC.
Well, we hope that video has helped some of you understand when we say home and community-based services, what that means. So it's that Meals on Wheels, it's congregate meals, it's transportation to health appointments. So Juan, how has the pandemic affected your ability to provide these services? And just talk about that a little bit.
Well, thanks again for having me. Needless to say, many of our senior centers and senior services and programs have suffered tremendously throughout the pandemic. However, some of our services and programs have actually expanded. Many senior centers restricted or had very limited physical access to their facilities. However, some core offsite services were expanded, actually expanded, throughout 2020. Services throughout our region were able to expand nutrition and transportation services thanks to additional funding received, as a result of the pandemic. Additionally, we have also been forced to think outside the box, asking ourselves questions like, how can we reach seniors virtually, considering many of them, do not have any technology or technical savvy to interact with us, and also how do we keep them safe under the new norm, when we do return, to normal operations. So in hindsight, there are some positives in 2020, but unfortunately, when you step back and you look at the big picture, there's still a huge number of underserved or people or seniors that are not receiving any services at all.
And do you want to just touch on why people, what's the benefit of allowing people to age in their communities or in their home versus going into long-term care facilities?
Well, research has shown that enabling our seniors to age in their communities, it yields a significant cost savings to families and caregivers, as well as the government programs that support the elderly. There is also evidence that seniors' overall health and well-being, both physically and emotionally, are significantly improved as well. And it has been said that the average senior, I'm not sure where I read this, but the average senior can be provided a full year's worth of meals for less than the cost of 1 day in the hospital or 10 days in the nursing home or rehab facility. So that right there, will give you some impact as to how significant those cost savings are. So it is very important, for the seniors to be able to age in place, and if you think about, ourselves as we all get older, and we don't want to be isolated from our homes or our loved ones, and placed in a long-term facility. It would have a tremendous emotional impact on, all of us. So, I definitely feel like, there's a tremendous amount of benefit from all aspects, to allowing our seniors to age in place.
Thank you. I think we've gotten a taste of some of these different programs. Senator Burgin, is there any other strategies that we're taking at the legislative level to address all these programs? I know we need additional funding. Any kind of studies?
Well, one of the things we're doing is looking at all the programs. There are so many different programs that sometimes I think we can have some where we really don't know exactly what a program's doing, and it may not be that we're being efficient with our money because of the administrative costs of other programs. So one of the things that we did this time when we went through the block grants and everything is we tried to start looking at exactly what services are being provided, who's doing it, what are the success rates, and then starting to drill down into how we look at it going forward. So I'm taking this on as a long-term mission. I want us to provide great services that are efficient, and then I want to monitor the results. If we do a program but the results the program's not driven by the results we get, then I think we're not being efficient in how we're spending the money. So I'm committed to this. I want us to look. My dad was a World War II veteran that lived to be a week away from being 90, and died in his chair at home. So I have lived through this with my parents, my wife's parents, on everything from making sure that they had housing and food, and that they thrived, and that's what I want for all of our senior citizens, to be able to live their lives the way they want to, and to thrive in them. And as I said, I am becoming one of these folks. I want to make sure that the programs and services are there for all of us, and so I'm committed to it.
Well, one of those lines was exactly our mission, to let older adults live the lives they want to live as they age. So we are so happy that you are over in the Senate. We have a question from North Carolina Health News about adult daycare centers, and the fact that they are, the reimbursement rate is so low, and how do we change that so that they can be fruitful? Maybe either of you, maybe Heather, you can explain why we need adult daycare centers.
Yeah, I'll take a first stab at it, and anybody can chime in. But for those who don't know what adult day centers are, it's for older adults or adults with disability who need supervision during the day to stay in the community so that their family members or caregivers can work or get respite from caregiving. And so adult day centers are an important part of our continuum of long-term services and supports, and allow people to exactly live in the community the way they want to by providing that support. And they get great supervision and activities and engagement and healthy meals for up to 10 hours a day. So it's a great service. But we know that in the recent past, we've seen a trend of adult day centers closing throughout North Carolina, and we've lost about 30% of our adult day centers in the last 10 years, and only 40 counties have adult day centers in our state. So it's a service that we know is important, and we know we want to see it grow and thrive as older adults live in the community. And one of the reasons why we've seen these closures of adult day services is that the reimbursement rates haven't kept pace with time. Their rates are at the state level, they are set, and haven't been updated since 2006. We talked about the Home and Community Care Block Grant earlier in this call, and those services, all of those services except for adult day services, those rates are set at the county level. The block grant allows counties to decide what services are funded and at what level. And adult day services in the past has been sort of this breakaway from tradition. And so we're particularly pleased that House Bill 731 was introduced last week by Representative Donna White from Johnson County, that would allow those adult day services rates to be set at the county level, just like other home and community care block grants. Those rates are really low. Just to give you a sense, the national average is $75 a day for that service. North Carolina is paying $33.07 for adult day care, and then $40 a day for adult day health, which requires a nurse on site to be able to provide some of those cares and medication administration as well. So it's an important service. We know it's going to be even more important as we have more older adults. So it's an investment that we need to make.
Great. Anybody else have comments?
I'll talk a little bit about that.
Okay.
In one of my buildings in Anger for probably 12 years, I didn't run it, but I rented it to a lady that had an adult daycare. And so I saw how that worked, the efficiency of it. I knew a lot of the people that were there that were using the services. And I think that is a great alternative to allow people to stay home where their spouse might still be working or needs the respite care. So, there again, I'm all for those things. I think that there's an efficient way to do it. I don't think I was in conversations about the nursing and nursing shortage, and we've got facilities that are paying $200 an hour for contract nurses. Now, when you think that and then compare that to $40 a day for somebody, that's a big discrepancy.
Yeah, and although they explained this so well, I just want to reiterate that we have more and more unpaid family caregivers that, as the population shifts, they're going to need a break. So we'll have less people working and able to support that growing aging population. So we will need to try to support those caregivers as best we can. And this an adult day center is a great way to give them that break that they need, and also to benefit the person that needs that place to go and socialize. So we have a few minutes left. I will just, okay, there is one question. How do the folks listening in express their support for programs? Can we put on the screen how to sign up for advocacy alerts from AARP, and we can let you know how to sign up as an advocate, and you'll get emails. You'll hear about this bill that is being proposed on the House side to change the way that those adult day centers are funded, not funded, but just, regulated so that we can make it keep up with the times. So things like that, if you want to help us help the legislature get things through, sign up now. But a question that many of us have is, we didn't have a budget 2 years ago. I know you don't have a crystal ball, Senator, but what are your thoughts on getting one this year, and what's the timing?
I'm one of the appropriations chairs. We have turned in our healthcare appropriations budget. I think all of them are turned in. We're waiting right now for a number from the House. We have to come up with a number that we both agree on. We're about $600 million apart. We're hoping to have that done in about a week and a half. And my prediction is, and of course I've not been there a long time, but I've been involved in a lot of stuff, and is we are going to have a budget this year. I think it's going to be a good budget. I think it's going to cover a lot of things that we missed 2 years ago. So stay tuned. But yes, we're going to have a budget this year, and I think people are going to. It's not going to do everything everybody wants to do. I don't think a budget can ever do that. But we are spending money. But we're also trying to plan to make sure that the recurring costs that we're going to make, that we can continue. I don't want to start a program that we can't make. I have a motto: a promise made is a promise kept. And so when we make a promise to a senior citizen or to a child, I want us to make sure that we're funding those for the future. But my prediction is we will have a budget.
That's great, because there's so many programs that we need to keep going and change as we see the growing needs. Heather and Heather, Juan, do you want to say anything in closing? We have a couple minutes.
Just want to touch on the adult daycare. I've been on both sides of that spectrum, and I've been a parent. Providing child care, paying for child care, and I've also I was blessed to see my father live to be 96 years old, and there's a big discrepancy in the amount of support that children get versus the elderly. And, we have to keep in mind that the demographics of our country is changing. The family structures are changing. My sister, I had 6 siblings when I was younger, so we were able to keep our father in his home and to help him age in place. But the families are smaller now. And, basically, as things are changing, we need to try to take into consideration that, the elderly population is growing, and we have to put some parameters in place to help, fund these adult daycare facilities. That is a huge concern to me. I really want to see that happen. It's something that's near and dear to my heart.
Thank you. You helped to reiterate how important it is to look at our changing demographics. Heather, a quick comment?
I think Juan said it really well, but I think, North Carolina is a great place to live, and we've got great networks of providers across all different kinds of services, whether it's home and community-based services or long-term care facilities. We need quality care everywhere, and people need to have choices. So I think that's increasingly important. And I think we've got a lot of innovation and opportunity as we move into kind of this new changing demographic, and we need to take full advantage of that to have quality programs that have good outcomes and keep people healthy.
Well, thank you all for being part of this. Senator, we know you have a lot of work in the coming weeks. If any of us can be of any support, just let us know. We will, would love to help you support these programs in the overall budget. Again, thank you for your service. Juan, thank you for sharing provider's perspective. And Heather, as always, great to have you as a partner with your broad knowledge on all these important issues. So everyone, thank you for being part of this, and thank you all for viewing this. It's really important that we understand